Good morning. Today we begin to address a term called radial reflex, also known as brachioradialis reflex. So, what is brachioradialis? Well, it's a tendon present on the thumb side of the forearm before the wrist region. All right? But what is reflex then? As we all know, it's a impulse or the way the nerve system works, the impulse transmission, the pathway. Am I right? So what happens is when the C5 and the C6 nerve roots, the spine, is under examination for certain reason, a radial reflex test is conducted where we try to check the involuntary deep tendon reflex and to see whether is it normal or abnormal. So through this, we try to see whether the forearm flexion and the supination, that is turning the palm upward, will it happen or not? So what do you generally do? You ask the patient's arm, or rather ask the patient to relax their arm. Make the patient's arm position, that is midway between the flexion and the extension. Forearm partially pronated, that is palm turned downward. Then what happens? The clinician strikes the tendon with a reflex hammer to observe whether the forearm moves in response to the reflex. So if the person is normal, the reflex will be visible. It will be an involuntary contraction of the brachioradialis muscle, and the forearm reflex and supination would be observed. But on the other hand, if it is abnormal, there are four different abnormalities that could be observed. That is hyporeflexia, where the motor neurons will be decreased due to the C5C6 damage, or hyperreflexia, where there'll be a brisk reflex action due to the upper motor neuron uh, problems, especially spinal cord lesions, or innervated supinator signs. Arm is not able to move, and this can be due to cervical spinal lesion, or asymmetrical response, where there is a difference in the reflex between the right and the left side. So, clinical significance of the radial reflex is observed in terms of cervical radiculopathy, or upper motor neuron lesion, or lower motor neuron lesion, or brachioradialis